morning po. Magpapapasok na po tayo ng mga attendees. Reminders lang po to all panelists po. Please, for the meantime po, please hide your camera and off your microphone po. Thank you po.
Wala daw akong video. Taon na lang namin. Start my video.
Good morning to everyone. We warmly welcome you to our first webinar series on road safety, a decade of success ahead. For this webinar series, we take a look at our success, challenges, achievements, and lessons on road safety, as well as the initial project results of the health burden of road crash in the Philippines under the UP Manila National Institutes of Health and the Department of Health. I am Sophia Francesca Lu, and together with me is Dr. Jinky Leilani Lu, and we are your masters of ceremony for today. To begin our program, let us all rise for the Philippine National Anthem.
Bayang mabiliw, pelas ng silanganan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiging, sa manlulupi, di ka pasisingin, sa dagat at bundok, sa simoy at sa langit mong butaw, may nilagang tula at awit sa paglayang minamahal, ang kisag ng matawat mo'y tagumpay na natinig, ang bituin at araw niya kailan pa may di manigilig, lupa ng araw ng walang ipagsinta, buhay ay langit sa piling mo, aming ligaya na pag may mga api, ang mamatay ng dahil sa'yo.
Thank you, Sophia. Sophia Francesca Lu, my co-host for today, is a lecturer at the University of the Philippines, Diliman. She is also a PhD candidate at CARSQ, Queensland University of Technology, Australia. She is also a co-proponent of this project on road safety. Road traffic crashes are not and should not be dismissed as merely everyday events. It is a leading killer of people and puts enormous drain on the country's human health and financial resources. Road accidents involve massive costs to often overburdened healthcare systems, occupy scarce hospital beds, consume resources, and result in significant losses of productivity and prosperity with deep social and economic repercussions.
In the Philippines, we have the Health Burden of Road Crash Injuries program led by Dr. TEODORO HERBOSA and Dr. Jinky Leilani Lu. Today, they will be sharing some key initial results from this program, along with distinguished speakers who are key people in the road sector to talk on the road safety status in the Philippines. To begin our program, may we call on Dr. Jinky Leilani Lu to introduce the Executive Director of the National Institutes of Health.
She is a research professor at the University of the Philippines National Institutes of Health, as well as a clinical professor and head of the Division of Clinical and Metabolic Genetics at the Philippine General Hospital. She also served as Vice Chancellor for Research of UP Manila from 2014 to 2018. Dr. Cuchonco de la Paz was a 10 Outstanding Young Men Awardee for the field of genetic medicine in 2002. In the same year, she was recognized by the National Academy of Science and Technology as one of the outstanding young scientists. She was awarded the 10 outstanding women in the nation serving for medicine in 2007. Dr. Eva Maria C. Cuchonco de la Paz is currently the director for the health program of the Philippine Genome Center and the executive director of the National Institutes of Health. Everyone, Dr. Cuchonco de la Paz.
Good morning. Good morning, and thank you, Dr. Jinky Lu, for your generous introduction. Honorable Health Secretary, Dr. Francisco Duque III, Honorable Transportation Secretary, Arthur Tugade, Dr. Mario Villaverde, Undersecretary of Health, Mr. Mark Stephen Pastor, Assistant Secretary of Transportation, Police Colonel Kirby John Brian Kraft, Director of PNP Davao, Dr. Beverly Ho, Director of the DOH Disease Prevention and Control Bureau, Dr. Caroline Lukazik and Dr. John Juliard Go from the World Health Organization, Dr. Mark King from Queensland University of Technology, our beloved professor, my beloved professor, Dr. Ted Herbosa, overall AHEAD program leader for road safety, and Dr. Jinky Lu, NIH research faculty and project leader for road safety. Friends, partners in development, good morning. This webinar, organized by the University of the Philippines National Institutes of Health and the Department of Health, cannot be more timely for two reasons. First is that this week coincides with the 6th UN Global Traffic Safety Week, celebrated every May. The second is that this week is the launch of the WHO's Decade of Action for Road Safety 2021-2030, and its global plan emphasizing the importance of a holistic and data-driven approach to road safety. Coupled with our efforts from today's proceedings, I am confident that road safety will gain ground as a bigger priority for our policymakers as well as policy implementers. As the National Health Research Center, we at the National Institutes of Health believe that road safety is a health issue. In this light, NIH will explore the possibility of putting up a study group and perhaps eventually an institute of road safety, injury, and post-crash response to provide evidence-based and data-driven research towards safer roads for all. We also hope to be able to draft a joint memo circular for the consideration of all concerned agencies, the Department of Transportation, LTO, DPWH, PNP, MMDA, with the lead agency being the Department of Health, on road safety pillar programs covering road safety management and policies, safer roads and transport, safer vehicles and mobility, safer behavior or road users, and post-crash response, as well as on specific concerns like bicycle lanes, motorcycle lanes, child restraints, not only in private vehicles, but also in the public utility vehicles. And so it's very important for us to have this joint undertaking with the concerned agencies. Amidst this global health crisis, it is time that we focus our energies on preventing the preventable. The pandemic has forced us to look towards active mobility and transport alternatives. We witness the transformation of the once bumper-to-bumper traffic into more dynamic and physical forms of movement, from bikes, scooters, and even carpooling. I hope that the gains of this study would encourage our policymakers to prioritize and institutionalize more sustainable forms of transport. With this, I congratulate our colleagues from the UP Manila National Institutes of Health, Dr. Ted Herbosa and Dr. Jinky Lu, their project team, as well as their collaborators who made this research possible. To all the attendees, I hope you join us towards safer and healthier roads for all. Maraming salamat po at magandang araw sa inyong lahat.
Thank you, Dr. Eva. For the welcome remarks, we now have a video greeting from the Secretary of the Health of the Philippines, Honorable Francisco Duque III. Honorable Francisco Duque III is a Filipino physician and government official serving as the Secretary of Health since 2017 and previously from 2005 to 2009. From 2010 to 2015, he served as the chairman of the Civil Service Commission.
Good morning to our distinguished guests, partners, and to everyone joining us in this webinar. The changing circumstances as to how Filipinos move and go about their everyday lives have underscored the importance of ensuring road safety for all. According to our online National Electronic Injury Surveillance System, or ONICE, transport and vehicular crashes remain to be the top cause of reported injuries. The onset of the pandemic has only further emphasized the need to improve the safety and accessibility of our road networks. There are many ways we can improve road safety that go beyond the obvious reduction of preventable and related injuries and deaths. We must explore the option of making our roads more equitable and improving pedestrian access to the streets for almost 90% of Filipinos who do not have access to cars. In light of this, your Department of Health recognizes the urgency in developing policies that draw on the principles of inclusivity towards building healthy communities. While the DOH continues to expand its efforts in health promotion and preventive care, we also recognize that the path to road safety will involve working with various stakeholders from our national government agencies, civil society organizations, and the private sector. We have to ensure equitable access to our roads, but to also ensure that people share the road safely. We are fully aware that improving road safety will entail a comprehensive reform in plans, policies, and infrastructure. However, as we continue to work on such reforms, we should remind ourselves that the duty of improving road safety is a responsibility shared by everyone, especially by the users who traverse the road networks daily. So let us all work together to achieve better health outcomes for every Filipino and ensure health-promoting and equitable developments in the country. Together, we can secure the safety of the Filipino people, no matter where they go and how they get there. Maraming salamat po.
We now have Dr. Mario C. Villaverde to grace this webinar with his welcome remarks. Dr. Mario Villaverde is the current Undersecretary of Health
and
of
how
the
they get
Department
there.
of Health Philippines. He oversees health policy and systems development and international health cooperation. Prior to this, Dr. Villaverde worked as Associate Dean for Academic Affairs at the Ateneo School of Government. His work, research, and advocacy cover public health, health systems development, and public management and governance. He also teaches public policy and health governance at the Ateneo de Manila University and the Development Academy of the Philippines.
It is with pleasure that I welcome you to the opening of this important webinar entitled A Decade of Success Ahead, a series of webinars on road safety. Let me begin by saying that over the past decade, the country has achieved much progress in road safety legislation. However, the high incidence of road traffic injuries and fatalities remains a major public health concern. Every year, Over 12,000 Filipinos die due to road accidents, while in terms of daily adjustment life years or DALYs, 635 life years are said to be affected due to disability per 100,000 road crash survivors. As part of the country's way forward in improving road safety, we have reaffirmed our commitment to keeping Filipinos safe on the road by participating in WHO's second decade of action for road safety 2021 to 2030. This gives us a target of preventing at least 50% of road traffic deaths and injuries by 2030. We recognize that improving the road safety situation in a country is not an easy feat, but a complex undertaking that requires national policy adjustment. To follow through our commitment as government and public sector, the Department of Health, together with our partner, DOST, PCHRD, remain supportive of programs and research endeavors that develop intervention measures and generate evidence in the development of policies for the prevention and control of road crashes and fatalities. It is our hope that this series of webinars become an avenue for an action-based discourse on ways forward to improve road safety in our country. We look forward to an informative and engaging discussion. Once again, welcome and good morning.
For our next welcoming message, we have the Director for Disease Prevention and Control Bureau. Dr. Beverly Bev Lorraine Ho is a Special Assistant to the Secretary of Health for Universal Health Coverage at the Department of Health Philippines. Immediately prior to this full-time designation, she was Chief of Research Division of the Health Policy Development and Planning Bureau, where she worked to provide the evidence needed to support health system reform by designing innovative research grants and building institutional capacity for policy research. Dr. Bev is a fellow of the Maurice Greenberg World Fellows Program at the Yale University, the Equitative Initiative, and the Atlantic Institute. She holds an MD from the University of the Philippines and an MPH in Health Policy and Management from the Harvard T.H. Chan School of Public Health as a Fulbright Scholar.
Hello, good morning, everyone. Good morning to all who's been joining in different parts of the country to participate in this webinar. Good morning also to Dr. Ted and Dr. Jinky, who's spearheading this work. A pleasant and healthy morning to all of you. From the DOH side, as mentioned by Sec Duque and USEC Villaverde, we're really very happy with this initiative, and that's why the DOH continues to support research or research translation initiatives like this, because these will be very essential in policy making. Transport is an essential part of our everyday lives, and particularly during this pandemic, this was uncovered. No, the importance of this aspect was highlighted. And we know that we all spend a lot of time going to work, going to school, places of leisure, even worship. And so while our time on the road has greatly been reduced during the time of the pandemic, it has emphasized the very critical role of making sure that roads are safe, not only for transport, but people who actually walk, no, for pedestrians. We also know that many Filipinos continue to be pedestrians, no, or owners of non-cars. So that would be bicycles and motorcycles. So as such, road safety remains a very great concern, especially for 90% of Filipinos. Cyclists and pedestrians are among those 90% and are most vulnerable to road crashes and related injuries and deaths. So, due to concerns for road safety and inequity, the road remains inaccessible, we know, and unsafe for many vulnerable sectors, including our senior citizens, persons with disability, lower income families, and women and children. So, we at the Health Promotion Bureau and the Disease Prevention and Control Bureau of the DOH, in cooperation with the national and local governments, civil society, and the private sector, have leveraged our current circumstance to fast-track the initiatives on road safety reforms through the promotion of active transport. Research and on-the-ground experience has shown that installing certain interventions, such as bike lanes and promoting active transport through other means, can significantly reduce road crashes and related injuries and fatalities. In addition to the benefits of active transport on our health, reducing non-communicable diseases, its impact on the environment, less carbon footprint, and also transport efficiency, and of course, economic recovery, which will again circle back to having health impact. So as our secretary has already said, improving road safety reform needs to have impact or work at the various levels. And we look forward to getting a lot of insights, inputs from these four series webinar sessions. Our team will be joining you in all of these sessions, and hopefully through this platform, we can really build partnerships, or we can grow our work together and make sure that our roads become safer, more equitable, and more accessible to every Filipino. So maraming salamat po. And my teammates, Maddie and Dasha, will be here to also help answer your questions if there will be any. So thank you very much. Good morning.
Thank you so much, Dr. Bev. According to the World Health Organization, the risk of dying in a road traffic crash is more than 3 times higher in low-income countries than in high-income countries. In the Philippines, UP Manila NIH is working with several institutions for the health burden of road crash injuries in the Philippines to increase the safety of roads in our country. To introduce this webinar and how we are working towards road safety, we have Dr. TEODORO J. HERBOSA, the overall program leader.
Dr. Teodoro Ted Herbosa was the Health Undersecretary of the Philippines from 2010 to 2015. One of his important accomplishments during his term was helping achieve universal health coverage. He also led the modernization of public hospitals through the Health Facilities Enhancement Funds and the public-private partnerships. He was the Executive Vice President of the University of the Philippines System from 2017 to 2021. During his term, he has several accomplishments. As a chair, the university hosted 2 international conferences and strengthened relations with Southern Taiwan University. He further expanded knowledge of the university on the road safety emerging interdisciplinary research and created the UP COVID-19 Pandemic Response Team. He is currently a special advisor to the Philippines National Task Force Against COVID-19. He is also a professor of emergency medicine and trauma surgery at the UP PCH.
It is with deep gratitude on our part that all of you are here with us for this webinar series. I would like to thank Honorable Secretary Francisco Duque III for taking the time to give us words of encouragement, especially in these trying times. We're also grateful to USEC Mario Villaverde and Director Beverly Ho, who have graced this occasion. Thank you to our dear colleagues, Dr. Eva Cochonco de la Paz, who is herself in the forefront of research and leading the National Institutes of Health Scientists to be game changers in the health of Filipino people through research and advocacy. We have indeed so excited that we have a large number of participants, a total of 710 so far registered in this first webinar. Our program has stirred curiosity among all of you, and we are all road users, either as drivers, or passengers or pedestrians. We use roads every day to get to work, school, or to go to church, to run for groceries, and even to get our favorite leisure spots. Whether we walk or ride, each of us are either drivers, passengers, commuters, or pedestrians. About 1.25 million people around the world die from road accidents each year. That's 3,400 deaths each day. Nearly half of these casualties are the most vulnerable road users: pedestrians, cyclists, and motorcyclists. According to the World Health Organization, among people aged 15 to 29, road crashes are the leading cause of death worldwide. Imagine that. We organized this series. I had road safety webinars with one thing in mind. Road safety is the government's responsibility. It is everyone's responsibility and should be everybody's priority. In partnership with the Department of Health, the Department of Science and Technology, the Philippine Council for Health Research and Development, the UP Manila National Institutes of Health, we want to be able to achieve three things through this initiative. First, raise awareness of the findings of the researches, the epidemiology of road crashes and injuries in the Philippines, and constructing an index for road safety and how these findings are able to translate to real-life situations on the road. Next, encourage a whole-of-society approach when tackling road safety. For this webinar series, we have representatives and speakers from the national government agencies, from non-government organizations, policymakers, and the academe. We want everyone to talk about road safety. It is a pressing matter that we need to discuss at all levels, may it be in the barangays, in LGUs, and the national level. Lastly, we want the Filipino people to know more about road safety in the Philippines, the current policies and private and public plans in the near future. This is a space for Filipino public to know their rights and responsibilities when using the road and how they can contribute to make it safer for everyone. To make this three things feasible, we have our four-part series for AHEAD road safety webinars. Today, we have road safety management and policy directions. On June 2, we have safer roads, mobility, and vehicles. On June 9, we have post-crash response and safer road issues. And on June 16, we have evidence-based research and local government unit programs. We grounded all these sessions on the 5 pillars of the UN Global Plan for the Decade of Action for Road Safety, which are road safety management, safer roads and mobility, safer road users, and post-crash response. We have been cascading these pillars through our different initiatives in the national and local government levels to ensure we are working harmoniously to keep our roads safe for everyone. Our speakers today are paragons in their own fields and will be sharing with us both an overview and a deep dive into road safety. We want to bring road safety closer to the Filipino people now more than ever, and we are certain that the AHEAD road safety webinars can be a platform to make this possible.
Indeed, as Dr. Ted shared, we have to push for safer roads now for the future generation and to navigate safe spaces wherever they go. We encourage everyone to join us across all our sessions. You may register at the link by scanning the QR code on the screen. And for the question and answer form, please send it through the link shown on your screen.
As of today, we have a total of 850 registrants coming from all areas of the Philippines, from provinces and cities of Luzon, Visayas, and Mindanao, including various agencies, companies, universities, professional organizations, public and private sectors, as well as other countries. Our webinar series have steered much attention and enthusiasm among the Filipino people from all walks of life, as we are all road users.
We now move to the informative part of today's session. We have several speakers who will share with us their expertise and work on road safety as program managers and heads of institutions and agencies.
We have speakers from the World Health Organization to share with us some best practices in the Philippines and in Asia. We also have esteemed government officials with us today to let us have a deeper look into the road situation in our country. To share with us her expertise on road safety and the programs we have in Asia and the Philippines, we have Dr. Caroline Lukazik.
Dr. Caroline Lukazik is a technical officer at the World Health Organization's Regional Office for the Western Pacific, where she works to address violence, injuries, and harmful use of alcohol. She is a public health researcher and injury epidemiologist who works to reduce the impact of violence and injuries. She has a research background in preventing road traffic injury, among others. She has worked for global research institutes, universities, UN agencies, and non-government organizations across the Western Pacific and Southeast Asia. Through her role at the WHO, she performs epidemiological research and supports development, implementation, and evaluation of policies, strategies, and programs for preventing injury.
Thank you very much for that fantastic introduction, and good morning everyone. It's my absolute pleasure to be speaking during this important webinar series. So as introduced, my name is Caroline Lukazik. I'm a technical officer at the WHO Western Pacific Regional Office. Today, it's my pleasure again to speak about the WIPRO Road Safety Program in Asia and the Philippines within the context of road safety management and policies. Next slide, please. So as an overview of my presentation today, first of all, I'd like to share some very new data available through the WHO that looks at road traffic injury burden in the Western Pacific region and in the Philippines. This data was released earlier this year, so it's very exciting to have this updated resource. Next, I'll be reporting on regional progress towards 4 of the 5 road safety pillars, particularly strong institutional management, effective legislation, safe roads and safe vehicles. Towards the end of the presentation, I'll do a review. So looking back on achievements, challenges and lessons learned from the decade of action for road safety, which as we know finished in 2020. And then looking forward, we'll talk about the next decade of road safety action from 2021 and discuss the first global action plan on road safety currently being developed by the WHO. Next slide, please. So to give a bit of an overview about our large and complex region that our office works across, so the Western Pacific region is made of 34 different countries and territories. It's a very large and diverse region. We span from China and Mongolia down to Australia, New Zealand. We include all of the Pacific and some Mekong countries and of course the Philippines. Within 2019, there are over 318,000 road traffic deaths in our region alone. This is nearly 25% of global road traffic deaths. It's also very important to note that 25% of all registered vehicles in the world are actually within this region, and 75% of deaths occur among men. Next slide, please. So why are we seeing these very high rates of road traffic fatalities in our region? I want to share some snapshots, some quick examples and photographs from across our region to demonstrate and highlight some key road safety risk factors. So the first photograph I have here on the left is from Hanoi in Vietnam. It's a photo of a very popular intersection that's often used as a road safety example. Here we can see a lack of road traffic control and unmarked roads. We can also see the roads being shared by multiple different types of road users. So cars, pedestrians, motorcyclists, and cyclists. Again, all very little road traffic control. The next slide, I'm sure many of us are very familiar with this type of scenario. It's taken during rainy season in Manila, where you can see significant flooding in the roads. This issue, of course, isn't just common to the Philippines. Our region is heavily affected by cyclones and typhoons, causing flooding in urban and rural settings. Floodwaters increase drivers' risk of losing control of their vehicle and the vehicle sliding, again, as a severe risk for road injury. Next slide, please. My next example is from Phnom Penh, Cambodia, and this is highlighting the importance of helmet use and motorcycle safety. As you can see here, there's an overcrowded motorcycle and none of the passengers are actually wearing helmets. They also wanted to highlight the quality of helmet is extremely important. Low quality helmets will not be able to protect, as well as high quality standardized helmet design. The next example here I have is from the south of China, and this really illustrates the dangers around rural roads in many areas of our region. So rural roads often have poor road infrastructure, traffic control, diverse population density across the length of the road. There's less stringent law enforcement and divorced methods of travel used along the roads. In China, rural areas have 2 to 3 times higher road traffic fatality rates than urban settings. Next slide, please. My final 2 examples are from Pacific Island countries. The first one is from Port Vila in Vanuatu, and this is around speeding. So Vanuatu is a small Pacific Island country, and traditionally the road system has been very poor quality, mainly dirt roads, very little infrastructure. Over the last 10, 20 years, there's significant booms in infrastructure with these fantastic high quality roads being laid out across rural areas. What this has resulted in is people being able to drive much faster in their cars. And now the majority of road traffic fatalities in Vanuatu are actually due to speeding. My final example is from Honiara and the Solomon Islands. And this photo here is to highlight the dangers associated with alcohol consumption and driving, so drink driving. And current estimates show that apparently in our region, 25 to 35% of all road traffic injuries and fatalities are due to alcohol consumption. Next slide, please. So looking at different countries in our region and looking at road traffic death rates, again, this is reporting from a new data source that WHO has recently made publicly available online. We have some of the highest road traffic fatality rates and the lowest road traffic fatality rates in the world. You can see here the Philippines, the bar is highlighted in green. So in 2019, there were 13.4 road traffic deaths per 100,000 population. Next slide, please. What I find very interesting, this figure captures it very, very well, is the mortality by different modes of transport as a proportion of all road traffic deaths. I'll break this down a little bit. So for each country on the left-hand side, this bar graph shows what proportion of all road traffic deaths was caused by motorized four-wheelers, so cars, primarily cars, motorized 2 or 3-wheelers, so primarily motorcycles in our region, cyclists, pedestrians, and other sources. As you can see, the types of mortality differ significantly between different countries in our region. There's a lot of variety here. What I found very interesting about this figure was that for the Philippines, the vast majority, so over 90% of road traffic deaths were classified as other modes of transport. I reached out to our data people at headquarters and asked for a further breakdown on this. Next slide, please. And they presented me with the original data that was given to the WHO to make these estimates. So this data was from the CRVS, from the PSA. And you can see here that of over 10,000 road traffic deaths, over 9,000 were actually associated to an unspecified road user type. This is quite surprising because there is, as you can see, capacity to collect more information and detail around pedestrians, cyclists, motorcycle users, and car drivers and passengers. So what this sort of raises, it highlights that perhaps there is room for improvement around the depth of detail collected through this data source. Because as we know, the more detail we know about road traffic injuries, the more opportunities we have for effective and targeted prevention measures. Next slide, please. The last bit of data I'd like to share with you today is really looking at inequities in road traffic injury. This has been touched upon by a number of our previous speakers already, so I'm really happy to sort of highlight this figure here. On the far left, this pie chart, this shows what proportion of our population in the region live in low and middle income settings. So we see 89%, and 11% live in high income countries. The next graph around shows where the most vehicles are owned. So 75% of vehicles in the region are owned in low and middle income countries. and 25% are owned in high-income countries. Finally, the finals figure shows what proportion of road traffic deaths occur in low and middle income countries in a region. This is 96% of all deaths. This is a great proportion compared to 4% in high income countries. So what this really shows us is that road traffic deaths are definitely an equity issue. Next slide, please. So from here, I'll move to the next proportion of my presentation. And I wanted to look at progress made towards achieving key road safety strategies and policies across our region and also within the Philippines. So in 2018, the WHO published this report and it's available online. I put a link at the very bottom of the slide if you're interested in accessing more detail. And this report looked at existing policies and strategies for road safety across every country in the world. Within the Philippines, within the Western Pacific, 21 countries participated, and I'm very pleased to say that Philippines is one of them. So I'll go through the key indicators that we've collected data on around institutional management, effective legislation, safe roads, and safe vehicles now. So next slide, please. So institutional management. So as we know, appropriate institutional management is critical to coordinate road safety policy development and implementation at national levels. There are two key strategies that are very important for this. First of all, the presence of a lead road safety agency, and secondly, the presence of a national road safety strategy. So within 21 countries in our region, 19, so nearly all, had both of these strategies in place. One strategy was not funded, which of course presents some challenges in implementation. Finally, two strategies did not have set fatality reduction targets, which means that it's very difficult to measure progress made on strategy implementation. Next slide. I'm very pleased to report the Philippines presented very, very well across these four indicators. There is a national road safety lead agency, and there is, of course, a national road safety strategy, the Philippine Road Safety Action Plan. This is fully funded. The Philippine Road Safety Action Plan does also have a target to reduce road traffic deaths by 50% by 2020. So again, I'm very keen to hear, of course, we're in 2021 now. I'm very eager to learn from other speakers about progress towards the subsequent National Road Safety Action Plan. Next slide, please. So we know legislation, establishing and enforcing laws to address key risk factors are critical components of integrated strategy to prevent road traffic deaths and injuries. Within this study done by the WHO, we looked at 5 key laws, legislation. This is legislation for safe road user behaviour. We looked at speed laws, drink driving laws, helmet laws, seatbelt laws, and child restraint laws. Again, across our region, we had varied outcomes for this and not very good outcomes as well. They're quite low numbers there. Next slide, please. The Philippines had very strong reports against these 5 laws. So the Philippines does have best practice for speed laws. So in urban areas, the maximum speed limit is 40 kilometers per hour, and rural areas is 80 kilometers per hour. In regards to drink driving laws, the Philippines have a maximum back limit of 0.05% for all drivers. The WHO, however, recommends that young and novice drivers should have a back limit of 0. Best practice criteria for helmet laws, again, this was partially achieved in the Philippines. So although helmets meeting industry standards are required by all drivers and passengers of motorcycles, the helmets are not required to be fastened by law. Best practice law for seatbelts was met in the Philippines, and there was one study that was published and referenced in this report from WHO that actually demonstrated 80% of drivers wearing seatbelts in one province in the Philippines, which is great. Finally, child restraint laws. Only one country in the region reported to have this law in place during data collection in 2018. So Philippines' initial response was marked as no. However, as I'm sure many of you have really driven and led these initiatives, in 2019, a child restraint law was actually passed in the Philippines, mandating children under 12 years old and below to need to use child restraints in cars. Next slide, please. Okay, so moving on to safe roads. So as we know, when safety is taken into consideration during the planning, design, and operation of roads, substantial contributions can be made to reducing road traffic deaths and injuries. Across the region, countries performed relatively well across these different areas. Next slide. And the Philippines also performed very well. So all countries, including the Philippines, performed road safety audits. The majority of countries had design standards for safety of pedestrians and cyclists. So in the Philippines, it was classified as partial, as there was no legislation specifically on the separation of pedestrians and cyclists from vehicular traffic on roads. Nearly all countries performed systematic assessments of existing roads. Slightly fewer made investment to upgrading high-risk locations where traffic injuries occurred frequently. And slightly fewer still made investments into improving public transportation. Philippines is part of these countries. Next slide, please. The very final category I'd like to speak about is safe vehicles. This is quite technically dense, so I'll just give a really top-level overview here. But there are 8 key regulations around the construction of vehicles. So these are seatbelt anchorages, frontal impact, side impact, electronic stability control, pedestrian protection, child restraint anchorage points, and for motorcycles, anti-lock braking systems. Again, our region didn't perform too well across these indicators, with the majority, so 15 countries, only implementing no or 1 safety regulation above. 1 country implemented 2 to 6, and 5 countries implemented 7 to 8. And next slide. The Philippines implemented 1. This was around seatbelts, the presence of seatbelts in vehicles. Next, please. So looking back, as mentioned previously today, we have recently finished the first decade for action of road safety to span from 2011 to 2020. The WHO are reflecting on progress made, on barriers, on challenges, and on next step forward. And we've got these key points that we've come together to really guide our work moving forward. So first of all, we've really learned that political will at highest level is paramount. This leadership, this commitment, this investment is extremely important to making progress. Again, good governance is central to a safe system approach, and considering not just drivers, not just we're talking about road users, and also communities that are built around roads and use roads every day. It's important to contextualize road safety within the Sustainable Development Goals. So this is looking at Sustainable Development Goals beyond 3.6, so looking at other goals that road safety also has positive impact on, and really making sure our partners and our stakeholders understand the mutual benefit of investing in road safety to all of our agendas. We should have a greater focus on implementation and managing the evolving nature of mobility. And again, it's been mentioned a number of times below. Mobility is changing over time, and I think COVID really demonstrated this to us. All of a sudden in the Philippines, there was a complete decrease in public transport availability. We saw an increase in bicycles and motorized scooters. This is something that we need to be very dynamic and flexible about. And then finally, there's a strong importance of supporting low and middle income countries implement these 5 pillars of road safety. Next slide, please. So again, in terms of steps forward, as was mentioned earlier today already, in August 2020, the UN General Assembly adopted the second decade of road action for road safety. And this will span from 2021 to 2030. And this is a very ambitious target of preventing at least 50% of road traffic deaths and injuries by 2030. One of the key outcomes of this resolution was a call to WHO to develop the first ever global action plan for road safety. Next slide, please. So WHO have been very busy since August last year and starting to pull together the initial draft of this global action plan. We've had technical expert consultations at this point in time to develop the first draft. And this draft is available online for your review at this website here on my slide. And again, I'm very happy to share the details of this website with you so you can access it and review this strategy in your own time. We are currently asking for feedback from member states on this strategy, and we're asking for feedback via email. So the process would be to access a strategy, review it, read it, and email feedback to this email address here. The feedback deadline closes in the next couple of days, but I've been told that submissions will still be accepted into June. Over the period of June and July this year, the revisions will be made to the original action plan by the WHO task force. And in August 2021, we hope to have the first final version of the global action plan to share for further review and further comment. So again, we really call on all of our partners and countries. We call for government, we call for CSOs, for NGOs working in road safety, all the experts who will be implementing and using this plan to strengthen road safety efforts at national level, to provide feedback and really help guide us make this a useful and practical document for countries. Next slide, please. So finally, I'd like to thank you very much for the opportunity to speak with you today. I hope it's been informative and interesting. I'm always very open to further questions and dialogue. I've left my contact details here, my phone number and my email address, and I highly encourage you to reach out to me. So again, thank you for the opportunity. Salamat po, and thank you. Have a very fantastic rest of the webinar series. Thank you.
Thank you, Dr. Lukazik. Some of you might be wondering, how exactly are we achieving road safety today in our country? As mentioned earlier by Dr. Ted, we are trying to work with several sectors on road safety. And here is a video reminder on road safety. To talk about the World Health Organization's initiatives on road safety in the Philippines, we have with us today Dr. John Juilliard L. Go. Dr. John Juilliard Go is from the World Health Organization Philippines, and he will be talking on the WHO road safety program in the country.
Yeah, hello, Dr. Can you hear me now, Dr. Jinkilu?
Yes.
Is it better now? Okay. Yes. Okay, I was saying thank you very much for the opportunity for us to make a presentation on WHO initiatives to support road safety in the Philippines. Okay, so I'm not in control of my slides, so I think I'm ready to proceed to the next slide. So we are all aware, of course, that road safety is a major global public health and development concern. Every year, about 1.35 million people globally die in road traffic crashes. Road traffic crashes are currently the 8th leading cause of death for people of all ages and the leading cause of death for children and young adults. Road traffic injuries also have a serious impact on national economies, costing countries 3% of their annual gross domestic product. In the Philippines, next slide, road traffic injuries are likewise major public health and development concern. On the average from this PSA data from 2015 to 2019, road traffic crashes kill about 11,600 Filipinos each year. Road traffic injuries are currently the leading cause of death among Filipinos 15 to 29 years old and cost about 2.6% of the country's gross domestic product. In this slide, you will note that in the year 2020, there was some sort of a dip, a 37% decrease to 8,000 deaths versus 2019 data. And the reduction, of course, is most likely associated with the reduced mobility of the population during that year because of the COVID-19 pandemic. Overall, however, there remains an alarming number of crashes, injuries, and deaths in the country, and road traffic injuries remain a major public health and development concern in our midst. Next slide. This data coming from the Philippine Health Statistics of the DOH tell us that road traffic injuries kill children. They are among the top 10 leading causes of deaths among young Filipino kids aged 5 to 14 years old. Next slide. Now about WHO. Of course, it's a UN agency and has been a key partner of the country in addressing road traffic injuries. Now, WHO supports road safety primarily in 5 ways. 1, providing technical support to countries. 2nd, collaborating with partners. 3rd, coordinating the Decade of Action for Road Safety. 4, guiding global efforts. And 5th, monitoring progress through global status reports. On the next slide, related to these actions in the Philippines, we advocated for the adoption of the Safe System approach, the action plan for the Decade of Action for Road Safety, then 2011 to 2020, and SDG targets 3.6 on the reduction of road traffic deaths and 11.2 on safe, sustainable transport systems in cities. Next slide. WHO collaborated with partners such as the Bloomberg Initiative for Global Road Safety to provide technical support and reduce road traffic fatalities in the Philippines. WHO technical support was also guided by the Save Lives, as you can see in this slide. It's a road safety technical package which focused on speed management, leadership, infrastructure design and improvement, vehicle safety standards, enforcement of traffic laws, and post-crash survival. Next slide. To bring all of this together, WHO supported the Department of Transportation in the development of the Philippine Road Safety Action Plan 2017 to 2022, which became the roadmap for implementing road safety initiatives focusing on road safety management, safer roads and mobility, safer vehicles, safer road users, and post-crash care. Next slide. WHO in 2016 conducted legal and media assessments on road safety to identify legislative and media reporting gaps that needed to be acted upon, thus to help improve road safety legislation and other initiatives in the country. Next slide. Capacity building for road safety is a major strategy for WHO. On this note, and in collaboration with the Ateneo School of Governance and the UP Center for Integrative and Development Studies, WHO supported the Legal Development Program, which engaged 12 lawyers and road safety advocates from various government and non-government institutions, and over the long term, built their capacity to contribute to and advocate for regulatory and legislative improvements on road safety. Said legal development fellows, all 12 of them and a couple of others, were oriented on road safety and road safety legislation and were supported to engage in meaningful participation on various opportunities to improve laws and regulations and advocate for evidence-based legislations on road safety. Next slide. Similarly, because media is a very important partner, in collaboration with reputable media organization Vera Files, journalists were engaged with the Media Fellowship Program and journalists were trained on appropriate solution-oriented reporting on road traffic injuries. It was emphasized with them that the bigger story of road crashes as a public health and development crisis is important. It is devastating individuals and economies, but they are preventable through system-level solutions that address risk. On this note, media engagement was utilized as a strategy to advocate for change. Next slide. We now have, of course, our child restraint legislation, and WHO was a partner that helped make this happen. So WHO technical officers and legal fellows helped in the drafting of the child restraint bills back then. And we participated in PWG meetings, legislative hearings, and later on in the drafting of the IRR of the past legislation. We also organized an experts meeting on CRS with UNECE counterparts and supported various advocacy events for CRS use. Likewise, we supported a study done on the availability, affordability, and acceptability of CRS among Filipinos. Next slide. WHO also supported public advocacy events on road safety, such as the recently concluded UN Global Road Safety Week, an event which happens every 2 years. Next slide. We also organized workshops and stakeholders meetings to discuss road safety issues and concerns with partners and advocates. Next slide. We also engaged with local government units and we supported capacity building on road safety. Next slide. We were very active in media, or we are active in media from time to time with Vera Files and other media partners. We co-organized various media forums to create greater awareness and advocacy for appropriate actions on road safety. Next slide. WHO also organized several stakeholders meetings over the years to discuss relevant issues and foster wider participation on road safety. Lastly, because data is important, on the next slide, WHO also convened meetings to discuss issues and consolidate data and information on progress made over the years. Every 3 years or so, WHO has been organizing data consensus meetings, which provide information from the Philippines that are eventually incorporated and published as part of the global status reports on road safety. Next slide. In providing all this technical support to countries, of course, there are WHO tools that have helped us over the years, and these tools, for the information of everyone, are for everyone, and they're available at the WHO website. Next slide. So, to respond, what did the government do to respond to the crisis on the road traffic injuries in the Philippines? Of course, there are many initiatives done by government, led by the Department of Transportation and the Department of Health. And I believe there's a presentation from the DOTR later today in this webinar, and there's also representation from the Department of Health. And in the course of discussions, I think they would be presenting some of these more important initiatives and the progress made on the country on road safety. Over the years, there has been indeed notable achievements, as will likely be evident in our succeeding presentations and discussions today. But needless to say, we are still not out of the woods. And we need to continually build on the gains each time to continually make progress and attain greater impact. Next slide. It is notable, and I'm borrowing Neda's slide here, that road safety is already integrated in the Philippine Development Plan 2017 to 2022 as described under Chapter 10 on Human Capital Development of said document. Next slide. It is similarly embodied under Chapter 19 on accelerating infrastructure development of said PDP document. Next slide. Road safety is also embodied in the National Transport Policy of Government. And of course, road safety is a major issue of concern of the Department of Health. To conclude, next slide. There are many road safety initiatives already. Not prior to that, please. The next slide. Back, one slide back. One slide back. Oops, masyadong na-advance. Okay, we stay on this slide then. Okay, so there are many road safety initiatives indeed, no? And we commend government and relevant sectors for some of the progress made. But as mentioned, we are still far from over, and so many things still are needed to be done for us as a collective group of road safety stakeholders and advocates to reach our goals. This monitoring data from PSA on SDG indicator 3.6 on this slide tell us that there is still a long journey ahead for us to achieve the target of 50% reduction on road traffic deaths by 2030. Thus, we need to continue to build on our gains and continually move towards our goals. Next slide. There are some things, of course, that we can do now. First, we need to update the Philippine Road Safety Action Plan after 2022 and make sure it is fully funded and well implemented thereafter. Second, we need to strengthen our capacity for enforcement. We have enough policies and laws already as it is. The challenge now is on robust enforcement and implementation. Third, we need to harness support of civil society, and we need to continually advocate for greater awareness and actions on road safety. Fourth, we need to continue to engage with partners and stakeholders. And last, we need to systematically monitor and evaluate progress and make appropriate revisions to our plans and interventions as needed and appropriate as at times. Next slide. We can make things better if we are together. We need to continually work with each other to keep our roads safe. Thank you again for this opportunity to make a presentation at magandang umaga po sa ating lahat.
Thank you, Dr. Go, the National Program Officer for Road Safety of the World Health Organization, Philippines. Indeed, about 1.3 million people die on the world's roads and 20 to 50 million are injured every year. These numbers will continue to rise if we don't act now. Other countries are also working to lessen these casualties.
In Australia, the World Health Organization is also running similar initiatives on road safety. Dr. Mark King joins us today to share these programs and its successes. Dr. Mark King is the Deputy Director of the Center for Accident Research and Road Safety, Queensland, at the Queensland University of Technology in Australia. He was awarded his PhD in 2005 for research into the effective transfer of road safety knowledge and expertise to low and middle income countries, or LMIC. He has continued to pursue his interest in improving road safety in LMICs through capacity building, publication of research, and training of PhD and master students who conduct research in their home countries. He also conducts research on vulnerable road users, driver distraction, road safety, traffic engineering, and road safety policy and strategy. He is an associate editor of the esteemed journal Accident Analysis and Prevention, a board member of the International Council on Alcohol, Drugs and Traffic Safety, and the National Treasurer of the Australasian College of Road Safety.
Thank you, Sophia. Just starting my video. Yeah. Thank you, Sophia, and thank you, Dr. Ed and Dr. Jinky. Also, thank you for putting up a much younger photo of me in my introduction. It's always nice to see that I used to look a bit better than I do now. I'm very pleased to be able to participate in this series, and I'm very impressed by the amount of effort that's going into making sure that the Philippines has a good base for proceeding with its strategy. What I'd like to do today is to talk a bit about what we have been doing in Australia, partly to illustrate how strategies are really developed to meet the needs and the governance structures of a country, and that the WHO guidelines, the Decade of Action guidelines, are interpreted in different ways or put into practice in different ways in different places. And to talk about the Australian experience. Now, so I'll be talking about the responsibility for road safety in Australia. And what I found too was that we've reached a fairly important juncture between the end of the first decade of action and the beginning of the second decade of action, which means that what I'm going to be talking about is the way that Australia is looking at that transition. And we haven't really made our final decisions as yet, but they're well on the way. And in the end, I'm going to talk about some of the strengths and weaknesses that we have. So first, for some context, if we have the next slide, if you look at Australia and the Philippines, Australia is about 25 times the size of the Philippines in surface area, but we only have a quarter of the population. And that means that our challenges are in some ways different to the challenges that you have in the Philippines, and that influences some of the priorities that we have. Next slide, please. Could I have the next slide, please? Yep. The other issue is that Australia is a federation, so that although we have a national government, if we go to the next slide again, next slide. The state territories and governments, if you look at what they're responsible for, includes most of the things that are relevant to road safety, such as public transport, running the roads and doing most of the road building, police and ambulance services. They're all at state level, they're not at national level. So at national level, we have broader issues to do with engagement with other countries and a coordination role to some extent, but a lot of our road safety is really delivered at state level. Next slide, please. Okay, so the implications for road safety strategy then and road safety implementation is that it is state-based. Now at the Australian government level, we have what's called the Australian Transport Council, but that's actually comprised of the state ministers of transport. State governments are elected by the state population, and so the ministers are drawn from the party at the time, which means they could be from a different party to the party that's in the national government. We have a national body called AustRoads, which sets a whole lot of standards and guidelines, mostly for road infrastructure, but also for a number of behavioural sorts of things like licensing. But again, it's actually the peak body of the state road authorities rather than being something that has a national origin. So if you look at our national government, their action is limited to setting vehicle standards, but the actual checking of the standards and looking at roadworthiness is state. Regulation of heavy vehicles because they are travelling interstate all the time, and coordination of data, but not the data collection itself. What our national government has managed to do, though, is to influence what state governments do through funding, so that we have state roads, but we also have national highways. National highway funding is administered by the Australian government, but it's implemented by the states. But it means that the national government can influence that by controlling whether or not states get as much money as they would like to get to work on that. And also there's an influence through black spot funding. And we have Australian road rules. Now that's been something that's originated in the last 20 or 30 years. States still have their own road rules, but they try to follow the Australian road rules as much as they can. So the national government influences things rather than directly implementing them. Next slide, please. Now at the national level, there has been traditionally a national road safety strategy and a national road safety strategy task force or board. Although again, that tends to be more of a figurehead. You'll notice if you look at this diagram, we took a safe system approach in the first decade of action on road safety, and where the decade of action on road safety set out 5 pillars, we had 4 areas, and those areas only partly correspond. So the 3 that are exactly the same are safe roads, safe vehicles, and safe people. We didn't actually put in a pillar for road safety management, and we didn't put one in for post-crash care. And I guess that's been a feature in Australia. The emphasis on prevention has meant that prevention is a key part of what police and road safety agencies or road transport agencies are doing. And the post-crash care has really been left to health. So road safety strategy has ended up not really including that post-crash care. There is a move to try and do that a bit more explicitly, but at the moment it hasn't been. So if we move to the next slide. Okay, the other thing that I guess is really important in a strategy, there's been strategic planning by government going on in many areas for many, many years. And quite often you find that it's not evaluated, that you reach the end of a strategy and then there's a new strategy drawn up and nobody really pays much attention to what happened before. What has happened in particular with the latest road safety strategy, the end of the previous decade of action, is that we have been quite good at monitoring our progress and at evaluating it. You'll see on this graph there's a yellow line. That yellow line that goes down from the top left to the bottom right was the target for the decline in our fatalities. We expected to have a 30% decline in our number of fatalities. And then the black line shows our actual fatalities, which showed that we were doing pretty well at the beginning, but by the end we didn't. So if you look at the top right-hand corner, you'll see a little sign in red saying fail. So we rated ourselves as failing. The other thing you might notice is there's a red line there, which is about severe injuries. And that red line doesn't give data right back to 2011, sorry, because the data collection, while it's been very good for fatal crashes and fatalities for many, many years in Australia, the collection of injury data at a national level has not been, and different states have had different ways of doing it. And it's only in the past few years that we're gradually getting all that together to have a truly national reporting. Also note that there's severe injuries, whereas they don't cover all hospitalised injuries. We roughly have probably 10 hospitalised injuries for every fatality, and we have about 3 severe injuries for every fatality. Next slide, please. So as a result of that assessment, the rationale that came up for the current decade of action was to set out some various figures. So we said that we have 1,200 people approximately dying in Australia each year, about 3,000 serious injuries. We were 9% over our target for 2011 to 2020. And we note that hospitalised injuries are increasing, and this has been happening for some years. Fatalities are going down, hospitalised injuries are increasing. One of the reasons that we think that is happening is that we're getting progressively safer and safer vehicles. Those vehicles mean that people are much less likely to be killed in a crash, but injuries are still occurring. The other thing that crops up very importantly in Australia, if you can imagine, we've got that very large land area with a very small population. population is strongly concentrated in major cities. And so we have these regional and remote areas where people travel very long distances at high speeds, and that accounts for some very high crash rates. If you look at our crash rates for our cities, we're down around 2.2 fatalities per 100,000 population, which is equivalent to the really good records that were shown by Dr. Carolyn for places like Japan. But then if you look at our regional and remote areas, we have very, very high fatality rates, which are equivalent to countries in Africa, for example. So that's quite important for us. And also, we've done a very good, very systematic costing exercise, which says that costs to the national economy are about $30 billion per year. If you put that in American dollars, it's probably around 25 billion American dollars. And the figure that was given before by Dr. Go for 3% is an international estimate of 3% of GDP. But you can actually cost it and show it's different for different countries. For us, it's 30 billion. Next slide, please. So we now have a draft national strategy in place, and you'll see that it is rather different in structure to our first one. We still have, if you look at those three rings, safe roads, safe vehicles, and safe road use. They tend to be the core. And we still have, at the bottom, speed management. We see controlling speed as being important everywhere, because obviously in rural and remote areas where we have high speeds, it's important. In cities where we're trying to move to having more people cycling and walking, then having lower urban speeds becomes important too. Now also you'll see at the top, movement and place. We've got an emphasis on integrating road safety with mobility and with the interaction of road users in particular places, so that, again, in urban areas, we've got a lot more mixing of cars and trucks and bicycles and pedestrians. And we've also set targets, and setting of targets becomes quite political. So our previous targets of reductions were 50% of, well, we wanted the 30% reduction in actual fatality numbers. And that's a little bit of a cheat because our population is increasing. So to have been honest with ourselves, we should have looked for a 30% reduction in fatalities per 100,000. Our targets in the next decade are being set at that, according to that. So we're looking at a 50% reduction in fatalities per capita by 2030 to be consistent with international targets, and a 30% reduction in serious injuries. There's some argument about the serious injury one. I think it's because we feel we don't really have a good handle on why it is that our serious injuries are increasing and how it is that we can decrease them. Next slide, please. And underneath that superstructure of the safe roads and safe vehicles and safe road use, we've got a series of priorities that we set, and those priorities are specific to Australia. So they include our Indigenous Australians and regional road safety, heavy vehicle safety, some workplace safety, remote safety, various other things like that. And I guess the message there is that when you come up with your own Philippine strategy, it's going to have some things that are specifically Philippines type concerns. Next slide, please. Now, I mentioned that states have their own, states are different. So we have a draft strategy for my state, which is Queensland. And if you look at that, you can see both similarities and differences to the national one. And we've got movement in place at the top. Now at the bottom, we've actually got health and behaviour. And that's really because in Queensland, we've got a link similar to, as mentioned by Dr. Ho, of looking at improving active travel levels for health reasons and for sustainability reasons. And then when we look at how we're dividing up the 4 different areas. We're looking at road environment, which is a very familiar topic, but the other ones don't look as familiar. Our individuals area does actually cover things like road user behaviour, but it's also covered under other areas as well. And under individuals, we also go into areas that go outside road safety into more active travel, so more pedestrian activity, more walking. Places and spaces addresses some of these areas of interaction between road users. We now have a lot of shared paths between cyclists and pedestrians, and shared zones where we've got pedestrians mixing with traffic. And when we go into regional and remote areas where we've got this concern about speed and in-speed management, that's under places and spaces. Then we have a communities area, which is really about trying to mobilise the community. And it might surprise you to know that compared with places like the US, Australia doesn't have a very big tradition of community action. We do have, I'm a member of, as was mentioned, of the Australasian College of Road Safety, so we have advocacy at that level, but motivating communities to get involved in advocating for road safety and putting things in place is not as easy in Australia as in other places. And at the centre, I'll go to the next slide, please. At the centre of the previous one, we have got some things about how we're going to implement in Queensland. But firstly, I'll look at the national draft, and it goes down to saying how we should implement. And it's a bit difficult to read this slide, but some of the things it talks about are clear governance arrangement. Who is actually responsible, and what is their accountability? A big thing from my point of view is evidence-based policy and programs. Again, there are many things that people think are important for road safety where the evidence shows that they're not really. And having evidence-based programs and policies is really important. Transparency and accountability is mentioned. And I think if we have this honest monitoring and evaluation of what we do, that really helps. If we want to cover things up and make ourselves look good, and that's a way of not making sure that we're doing things properly. Related to that is having published dashboards showing rates of change. And there are some other similar issues below that. Next slide, please. So in Queensland, and again, this slide is a bit difficult to read, some of the things that are talked about are a bit similar to those that have been mentioned that are happening at the international and the Philippines level. Partnerships, trying to develop partnerships between industry associations, the community, and government. Research and data obviously is important. Technology, we're doing a lot of exploration of the implications of connected and autonomous vehicles and various forms of enforcement technology, such as cameras to detect mobile phone use, for example. And finally, investment. Next slide, please. Next slide, please. Okay, so because I've got limited time, I just wanted to briefly talk about this sort of implementation, translating the decade of action into strategies and into actions to implement those strategies. And I think my own view on what has happened in Australia and Queensland in the past shows up some strengths and weaknesses. I think that some of the strengths that we have is having a strong emphasis on setting targets, and it's been good that internationally that has happened as well. It's now also in the Sustainable Development Goals. For the first time, there is actually an international target, which is not just in the road safety area. The other thing is that we've been really focusing on making sure that we collect the data and that it's good quality. We've been linking our hospital data and our road safety data, police data, and as soon as you start doing that, you realise that both sets of data have their limitations, and there are many crashes that go unreported in the police road crash data, and there are many road crash injuries that go underreported or unreported in the hospital data. But we're moving towards improving that. We also have been actively promoting partnerships to implement change, and I think that's a strength. The open monitoring and evaluation I mentioned, and reliance on research evidence to inform actions. Some of our weaknesses, I think that we're not truly national, and states can choose to do other things. And of course, as soon as that begins to happen, you have the chance that there are some political issues that come up. Now, within states, we have to rely on relationships between agencies. And now I'm going back to some of my history here, where when I first came to Queensland, I had a big part in government of helping develop the first Queensland road safety strategy in 1993. And that was truly a whole of government strategy where we consulted quite widely with all other agencies. The second strategy that followed after that in 2003 was very much motivated within one agency of transport. And so it didn't have the buy-in. So a lead agency needs to make sure that they do that consultation. The other thing, which is a bit of a weakness in Australia, is we do tend to be top down. And I had a PhD student a few years ago who looked at this issue from a systems point of view and concluded that Australia would be stronger in road safety if we were able to integrate community voices more strongly into what we were doing. And that ties into the second part, that last part here, community engagement and involvement, where sometimes there are just vague aims of having the community engage without really drilling down to something that they can actively do. So that's basically the end of my presentation. If we have the last slide, thank you. That's my email address if you want to talk to me about anything. Thank you very much.
Thank you, Dr. King. Road safety should indeed be a priority everywhere in the world. To promote safer roads, we have a video reminder to keep our eyes on the road, do not use gadgets when driving, and refrain from getting distracted while driving.
Kuya, ready ka na ba? Excited na kami.
Pre, magpapatali ka na talaga.
Invited ako ah. Finally, mag-aasawa ka na.
Kuya, so excited for you!
Nakakabahan ako sa inyo lalo.
Kaya yan! Salamat sa lahat ng sakripisyo mo para sa pamilya, kuya! Oo nga, ngayon, sariling happiness mo naman. We're happy for you!
Talaga? O sandali, kinukulit ako ng barkada sa chat.
Love, nandito na ako. On the way ka na. Ingat!
We now go to the discussion of the initial results of our AHEAD program. AHEAD stands for Advancing Health Research, Health Evidence-Assisted Decisions. Professor Jinky Leilani-Lu will be sharing with us the results of this study on behalf of Dr. HERBOSA and the team. Dr. Jinky Leilani-Lu is a research professor at the National Institutes of Health, University of the Philippines, Manila. She has authored 2 books, namely Gender, Information Technology and Health, which won the National Academy of Science and Technology Book Award in 2010 and was reprinted by the University of Hawaii Press in 2007. Her second book, entitled Basics of Occupational Health and Safety, Guidebook for Practitioners and Industries, was published in 2011 by the UB Press. She also contributed chapters in books by Thomson Reuters recognized international publishers. She has produced 50 journal articles, all of which are Science Citation Index, thus earning her the title of University Scientist from 2007 to the present. She is currently the secretary and the next chair of a scientific committee of the International Commission on Occupational Health. Dr. Liu is a staunch advocate, both as an engaged academic and scientist, in promoting well-being among vulnerable populations, such as the road users.
Good morning to all of you. It is with great pleasure to share with you the results of our study on road safety. The overall program leader is Dr. TEODORO HERBOSA, and this program has two project components, and I am one of the project leaders. The title of this program is Health Burden of Road Crash Injuries in the Philippines. Project 1 is the epidemiology of road crashes and injuries in major tertiary hospitals in the country. And Project 2 is the construction of a road safety index. This research program, which has two research project components, is aimed at investigating road safety in the Philippines, eventually developing a road safety index or RSI. RSI is composed of components or variables that can be predictive of the road status of any place. By improving these components, the road safety status is also improved. The framework of this study follows the WHO Decade of Action for Road Safety. There are 5 pillars to road safety, which are road management capacity and policies. Second, safer roads and transport networks. Third, safer vehicles and mobility. Fourth, safe road behaviors. And fifth, post-crash response. These pillars of activities are needed to achieve the Vision Zero Safety Systems approach of the World Health Organization, and the Philippines is a signatory to this global action. For the study population, we acquired at least 10 years of data from each of the hospitals, institutions, and agencies concerned. The study was approved by the Department of Health, Single Joint Research Ethics Board, and the UP Manila Research Ethics Board. This presentation will show you the results of 4 databases. First, the Integrated Surgical Information System, or ISIS, of the UP-PGH Department of Surgery, which began its electronic record in 2008. Second, we have the Online National Electronic Injury Surveillance System, or ONAS, of the Department of Health, which started its dry run in 2009 and formally started uploading data from various participating hospitals in 2010. Out of the more than 2,000 hospitals, about only 304 on the average over the years have been uploading their data in ONAS, and their injury data contains transport and vehicular accidents. Third, we have the AHEAD database. AHEAD stands for Advancing Health Through Evidence-Assisted Decision. This covers 8 major tertiary hospitals nationwide where patient charts and medical records are retrieved manually and encoded by our research assistants. Fourth, we have the Metro Manila Accident Recording and Analysis System, or MARAS, which is a road crash reporting system created and maintained by Metro Manila Development Authority, or MMDA, in collaboration with the Philippine National Police. For the ISIS, there is a total of 4,979 road crash cases. Of these, majority were males at 80.2% and 18.8% were females. There's a 400-fold increase in road crash patients between the years 2008 and 2017, and a 21% average annual increase over the years. Next, we have the DOH ONAS. Hospitals across the Philippines encode patient data to the online servers of ONAS. All types of injuries are reported here, including vehicular accidents, falls, burns, drowning, assault, among others. We had to extract only the vehicular accident cases. The average number of hospitals reporting to the ONAS is 304 since 2015, but it was as low as 72 before 2015. On the average, there are 37 DOH hospitals, 98 government hospitals, and 167 private hospitals reporting to the ONAs. Majority of the data in the ONAs, however, come from the OH hospitals at 50.5%, followed by government hospitals at 26.2%, and then private hospitals at 23.3%. In the ONAs, the total number of cases is about 894,000, close to 1 million, from January 2010 to June 2019. Vehicular crash cases account for about 297,000 cases, or 1/3, and crash cases have an annual average increase of 26%. Across the years, vehicular crashes account to 27% to 40% of the cases in the ONAs. The proportion of vehicular crashes has become more steady and less fluctuating during the latter years, maybe because of the greater participation of hospitals in the ONAs. In Maras, the total number of cases is about 1.35 million, and that is a large data set from January 2005 to December 2020. Imagine having 1.35 million road crashes over a span of 15 years. Between the years 2005 and 2019, the number of crashes increased by 32.95%. On the average, there is an annual increase of 4.7% in road crash. The lockdown during 2020 could have influenced the sharp drop in the number of total cases in 2020. In the Maras dataset, pedestrian fatalities steadily decreased since its peak in 2015. Driver fatalities, however, continuously increase every year. Total drivers killed so far is about 2,700. Total passengers killed is about 800. Total pedestrians killed is about 2,600. The classification of crash is of 3 types: fatal, non-fatal, and damage to property. Overall, fatal crashes increased by 6.12% every year on the average from 2005 and 2015. However, the trend of fatal crashes is decreasing on an average of 80.7% since 2015 to 2020. This is a total of 6,019 fatal crashes. However, there may be more than 1 killed person in 1 fatal crash. Hence, the total killed in Maras dataset is 6,283. Then we have the hospital data gathering, or the AHEAD dataset. We have a total of 40,286 road crash patient data retrieved and encoded manually by our research assistants. The most number of charts encoded came from Davao Regional Medical Center in Tagum at 18,333, followed by PGH at 7,483, and then East Medical Center at 6,790. The other hospitals included in the project are Jose Reyes, Southern Philippines Medical Center in Davao City, Talisay District Hospital, and Vicente Soto Medical Center in Cebu. Due to time limitation, we will proceed to present the summary findings. The individual findings will be uploaded on YouTube, and it is about 30 minutes per presentation. In all data sets, age distribution is bimodal, initially peaking at age 5 to 7 and finally peaking at age 20 to 24. The result shows that the vulnerable age groups are the very young and those in their prime working age. There is a need to address safety in these age ranges. Majority of road crash patients in all data sets are within 20 to 29 age range, followed by those who are in the 30 to 39 age range. This reiterates the fact that the young productive age groups are the victims of road crashes. For victim type, across all databases, drivers make up the largest group of victims, followed by either the pedestrian or passenger. In the ONAs, there are more passengers than pedestrians, while in the ICES and AHEAD, there are more pedestrians than passengers involved in road crash. In ONAs, 46% involved in road crashes are drivers, followed by rear passengers at 26%, pedestrians at 14%, and then front passengers at 3%. The rear passenger is more at risk than the front passenger based on the data. In Maras, the driver died or was injured in 9.3% of incidents. The passenger died or was injured in 4.5% of incidents, and pedestrian died or was injured in 7% of cases. In all data sets, the motorcycle is the most involved in road crashes consistently for the past 10 years. In ICES, motorcycles comprise 77% of all vehicle types, 58% in ONAs, and 81% in AHEAD. In MARAS, motorcycles are involved in 19.5% of incidents, next to cars at 70.6%. There is a need to address the risk in riding motorcycles. Across datasets, motorcycles are also the most involved in hitting a pedestrian at 31% in ICES and 58% in both ONAs and AHEAD. This is followed by cars and tricycles in any order. We also look at inferential statistics on the effect of motorcycles on patient outcome. Patient outcome is of 3 classifications: died, recovered or improved, and unchanged status. In ONAs, vehicle type is significantly associated with multiple injury. Motorcycles have actual counts that are very much larger than expected for multiple injuries, including abrasion and burns. This means that motorcycles are implicated in multiple injuries. Motorcycles in the ONAs are also significantly associated with ER outcomes, with those who ride motorcycles having greater than expected counts on unimproved status. Using multinomial regression in the MARAS dataset, motorcycles are a risk factor to the driver himself being killed. The result shows that the risk of a driver being killed increases by 9.52 times when motorcycles are involved. Likewise, the risk of a passenger being killed increases by 2.73 times when he or she is hit by a motorcycle. For classification of crash, we have fatal, non-fatal, or damage to property. In MARAS, the result shows that riding a motorcycle increases the odds ratio of being involved in a fatal crash by 62.5% and non-fatal crash by 288%. The car and taxi are significant factors for damage to property. In the 4 datasets, alcohol is the most common risk factor resulting to road crash. The other risk factors are sleep and fatigue, which are forms of distracted driving, drugs, as well as non-use of helmet or seatbelt. Speeding, inattentiveness, and human error were also reported in the MARAS dataset. We again looked at inferential statistics on the effect of alcohol or drink driving and other risky behaviors. In ONAs, ER deaths and unimproved status for those who are drunk are very significantly higher than expected. Likewise, inpatient deaths for those who did not wear a helmet is significantly higher than expected. In MARAS, alcohol intoxication increases the odds ratio of a fatal crash by 889% on the average. Meanwhile, speeding increases the odds ratio of a fatal crash by 137% on the average. In the AHEAD dataset, it is not only alcohol that increases the odds of death in a road crash. Alcohol intake, drug intake, and fatigue are all significantly associated with deaths. Fatigue has a Phi coefficient of 0.158, suggesting a positive association with deaths. We only have 2 data sets with Glasgow Coma Score, AHEAD and ICs. Glasgow Coma Score is the most common scoring system used to describe the level of consciousness of a person following a traumatic brain injury and can be predictive for prognosis of road crash patients. The proportion of patients with severe brain injury in both data sets is almost similar, but it is worth mentioning that 7% of all patients in AHEAD and 6% in the ICs have severe brain injury. And this has implication to the overall outcome of the patients. In ICs, GCS is significantly associated with patient outcome. The recovered group has the highest GCS as expected, while the died and unchanged group generally have less GCS. Using multinomial regression, GCS is an important predictor of death. The odds ratio of GCS, 0.762, suggests that the lower the GCS score, the more likely that the patient will die. In particular, for every point of GCS that a person loses, the odds ratio of the patient dying increases by 31.23%. It is alarming for the AHEAD dataset. The number of deaths is significantly high among those with severe brain injury, as well as those with moderate brain injury. Specifically, for severe brain injury, the proportion of expected death is only 0.07%, but the actual death is 0.5%. This is 7 times larger actual deaths than expected. How many patients died? How many survived? How many had severe injuries as a result of road crash? In the ICs, 4% died, or a total of 4,276 killed persons from road crash. In AHEAD, 14% died, or a total of 5,255 persons. In ONAs, 1% died, or a total of 2,622 persons. In MARAS, 6,283 persons were killed. For the variable body part injury, only AHEAD and ICs have this data. Multiple injuries were the most common at 35.1% in AHEAD and 85.9% in ICs. This is more than 3/4 of all patients in PGH sustaining multiple injuries. This shows that road crash mostly involves injury to several parts of the body and not only to one body part. Specifically, the most reported body part injury is external injuries such as abrasions and minor cuts at 73% in AHEAD and about 43% in ICs. Victims also sustained injuries to the face, neck, chest, abdomen, and extremities. There is no body part injury information in MARAS and ONAs, but they have severity of injury information. On severity of injury comparison, in MARAS, the majority are comprised of damage to property at 80.5%. In ONAs, it is generally composed of serious as well as minor injuries. We tried to look at the body part injury association with patient outcome. Using inferential statistics, patient deaths are significantly higher for the following body parts: head and neck, chest, and abdomen. Specifically, the observed number of deaths for those who incurred head and neck injury is 79, while the expected is only 38.88, which is more than double. The same is found among those who suffered chest injury, where the observed count for death is 51, more than double the expected count, which is only 22.88. Where are the most dangerous roads located? The ICIS data shows that the most dangerous roads are in Cavite, NCR 4th District, then Bulacan, and as far as Batangas. In Maras, the riskiest roads are in Quezon City, then Makati, Pasig, Manila, and Parañaque. In Onays, Davao City has the most risky roads, followed by Quezon City, then Caloocan, Las Piñas, and Tagbiliran City. We also did geographic information system, particularly spatial analysis in identifying dangerous roads. Cases from Onays from 2010 to 2019 were aggregated from case level to city level, then a shapefile for NCR, Region 7, and Region 11 were all embedded. The data is then analyzed using area data analysis. Using this technique, it is possible to identify spatial clusters and spatial outliers. The figure shows us that the dark-colored areas are the most dangerous roads, while the lighter colors are the less dangerous roads. These three maps show how data in the Maras dataset is distributed throughout the National Capital Region. The leftmost map is the actual cases recorded per city. Here, Quezon City records the highest number at almost 20,000 counts. The next highest are Manila, Pasig, and Makati, respectively. The map in the middle is the number of cases recorded and adjusted to the city's population. Makati and San Juan here ranked the highest. Makati clocked 11,202 cases per 100,000 population, while for San Juan, it is 12,207 cases per 100,000 population. This means that in these areas, more than 1 in every 10 persons are involved in any sort of road crash incidents. The rightmost map is the number of cases adjusted by square kilometer. The top 3 cities are Makati, Mandaluyong, and San Juan. Makati has 2,385 road crashes per square kilometer, and Mandaluyong has 2,762 crashes per square kilometer. For both Maras and Onays, it is worth mentioning that Quezon City is the most reported place of injury and road crash. At this point, I would also like to share the analysis from the dataset given by the Cebu City Police Office. Space-time interaction is found for all criteria of closeness in time and closeness in space. This implies that in the areas included, if a road crash occurs, one can find another road crash within 1.11 kilometers, 111 meters, and 11.1 meters of the area within 30 days, 7 days, or 3 days. Hence, there is a proximity of space and time of occurrence of road crash. Road crash happens in every 11.1 meters, every 3 days at a minimum, or kada isang kanto sa bawat ikatlong araw ay may road crash. For the DPWH black spots or the hotspot analysis in Metro Manila, there were 8,933 observations containing locations of road crash incidents from 2016 to 2018. It is called black spots because these are where road crashes occur, while hotspots are where road crashes cluster. As you can see in the graph, cluster of crashes with low number of victim count lie around the northwest portion of Quezon City to Valenzuela. Manila City is also mostly composed of clusters of low values. Clusters of crashes with high number of victims lie around the lower part of Quezon City, around San Juan, Mandaluyong, Marikina, Pasig, and Taguig. There is another interesting analysis that came out of this project. It is on trauma scoring system. About 30 years ago, Champion and his colleagues introduced the revised trauma scoring, or RTS, which has been extensively used to assess outcome or prognosis in trauma patients. There are 3 parameters in the RTS as shown in the table, which are GCS, systolic blood pressure, or SBP, and respiratory rate, or RR, all of which can be assessed easily and manually. These variables altogether are known to correlate statistically with survival and mortality. The higher RTS is associated with a better chance of survival, while a lower score indicates poorer prognosis. As a variant, we have the Kampala Trauma Scoring, or KTS. It was developed in Kampala, Uganda, to consider the resource limitation of hospital settings there. It considers 5 parameters: age, SBP, RR, neurologic status, and severity of injury. Unlike RTS, it is not weighted. It is merely the sum total of all the parameters. Using the AHEAD dataset, we came up with a new scoring system unique to the Filipino people, which we call the Proposed Trauma Scoring System, or PTSS. We have no time to discuss with you the statistical derivation of our PTSS, but suffice to say that this is based on the principles of all the current scoring systems, the KTS, the RTS, as well as the TRIS. And suffice to say also that the logistic regression to come up with the equation and coefficients per parameter of the PTSS was based on the 40,000 plus road crash patients in the largest hospitals in the Philippines for the past 10 years. Now the question is, how good is our model for trauma scoring? Which is the best performing in terms of classifying who's going to die and who is going to recover? In this analysis, ROC-AUC, or Receiver Operating Characteristics Area Under the Curve analysis, was used to evaluate and compare how good the models are in predicting patient recovery. Visual analysis of the graph shows that the red line, which is our proposed scoring system, has a higher AUC than the gold standard RTS, the blue line. Thus, for the Filipino patients, the better scoring system and classifier is our proposed PTSS. Now we go to our summary. In the ONAs, there is a total of 296,760 total vehicular crash patients. In the MARAS, there is a total of 1.35 million road crash incidents and a mean annual increase of 4.47%. In the PGHICs, there is a total of 4,979 road crash patients. In the AHEAD hospitals, there is a total of 40,286 road crash patients. In all of the road crashes, the total number of injured persons across datasets is 623,314. This has economic impact affecting the individual, the household, and the country as a whole. On the other hand, across all databases, the total number of killed persons from road crash is 14,352. It is a large number of people needlessly dying from a reckless road crash incident. Now we go to our conclusion. The significant factors in road crashes we found in the study are the following. Victims are the very young. Victims are people in their prime working age. Motorcycles comprise the largest vehicle type involved in road crashes. Pedestrians are among the most vulnerable road users. Alcohol increases the risk of death and injury. Non-use of helmet and seat belts also increases death and injury. And our proposed trauma scoring system is superior and has a better classification rate for Filipino road crash patients than the gold standard revised trauma scoring, or the RTS. One of our recommendations is the need to harmonize the reporting and surveillance system for road crash and include essential data across institutions and across hospitals. This can be an output as a result of this webinar series. There are many more recommendations we are proposing based on the results of the study. Hence, decisions become assisted and supported by evidence, which AHEAD stands for. Finally, I would like to say that road crashes do not happen. They are caused. With that, thank you. Maraming salamat. Mabuhay ang Pilipino.
Thank you, Dr. Lu and Dr. Herbosa, for this valuable study. It is indeed helpful for everyone using our roads every day. We, as road users, should also be cautious and responsible, even after having a little bit of fun. To lessen casualties and injuries on the road, never drink and drive. Here's why.
Finally! I've conquered college! Pwede na akong bumuo ng dream designs ko. I can finally start saving up so I can buy her a ring. And then, we will have our dream house built. Kinda tipsy now, but here's another shot for being a step closer to my dreams.
Sa wakas, nakatapos din. Akala ko ako tatapusin ang pag-aaral ko eh. Pero hindi. Nandito pa rin ako. Boards na lang, legit engineer na ako. Pwede ko na mapa-opera si nanay. Pwede na rin kami magkaroon ng sariling bahay. Yung di na nakikitira.
Isa pang isaw para sa lahat ng sinikmurang hirap para sa pangarap.
Indeed, we must not rob others of their dreams and aspirations. After having fun, we must still be responsible. Refrain from driving after having a drink, no matter how much. With this, we now look at how our roads are doing in the Philippines. We have a message and talk from the Secretary of Public Works and Highways, Honorable Mark Villar. He previously served as the representative of Las Piñas in the Philippine House of Representatives.
Magandang araw po sa inyong lahat. Before I begin, I want to thank the National Institutes of Health and the program organizers for inviting me as a resource speaker for this webinar and for organizing this event that will serve as a great platform for discussing such a very timely and relevant manner in today's current situation. It is a huge honor. Allow me to share the different measures that the government, through the Department of Public Works and Highways, has taken to ensure the construction of safer roads, not just for the motoring public, but for every stakeholder. According to the World Health Organization in 2016, an estimated number of 12,690 Filipinos died due to road crash accidents. Data shows that approximately half of these deaths are among the most vulnerable road users, pedestrians, motorcyclists, and bikers. As the engineering and construction arm of the government, it is a huge responsibility for us to safeguard motorists as well as pedestrians by making sure that the roads, no matter what type of vehicle they use or whether they travel by foot, does not add up to the factors that increase the risk of accidents or possible fatality. With the DPWH's mission to provide and manage quality infrastructure facilities and services responsive to the needs of the Filipino people, the agency has developed various manuals in road safety and has incorporated them in the process of building national roads and bridges. Starting from the planning stage up to the detailed engineering design, but not limited to the implementation of the project. yet also involves the preventive maintenance of the completed infrastructure. DPWH has created and issued the Highway Safety Design Standard Manuals, Part 1 and 2. The use of these manuals will allow every builder to raise awareness to every road user by providing credible instructions to drivers and pedestrians, as well as to maximize the safety component of road infrastructure. Aside from the national road networks and bridges, the guidelines are also applied to projects implemented by local government units and by the traffic management and enforcing authorities in order to make it easier for all road users to identify the signages and its usage. Moreover, DPWH does not prioritize only motorized vehicle owners, but also cyclists and pedestrians. With the increasing number of people opting to use the alternative modes of transportation as part of the new normal, such as bicycles and scooters, bike lanes are being set up and bikers may pedal worry-free soon once more safe and inclusive bike spaces are built. In Metro Manila and other metropolitan areas in the country such as Cebu and Davao, installment of bike lanes for Filipinos opting to cycle were completed, while some are still in the works. The success of such actions in providing Filipinos an effective and safe alternative prompted our department to adapt to the ever-changing needs of our stakeholders and approve the inclusion of bike lane construction in our future projects. In 2020, the policy prescribing the guidelines of bicycle facilities along national roads has been finalized and released. With this, we aim to provide a uniform design of bike lanes to achieve a consistent approach in connecting our metropolitan cities and possibly nearby municipalities, while meeting the needs and safe access of bicyclists and other road users to these facilities. These bike lanes and sidewalks are designed to ensure that the roads are shared by all stakeholders and are placed strategically to provide safe pathways for non-vehicular traffic. Marked with highly visible pavement markings, these lanes are equipped with the design and safety features that will allow motorists to see riders and pedestrians even at night. A first protected bike lane along National Highway was built by the DPWH along Laguna Lake Highway, formerly known as the C6 Tyke Road. Unlike other bike lanes that are only painted on the road, the Laguna Lake Highway bike lane is protected and separated by a 2-meter plant strip from the motor vehicle lanes. Laguna Lake Highway is an alternate route to EDSA and C5 connecting Lower Bicutan in Taguig City to Taytay, Rizal. Over the years, DPWH has considered quality and safety as top priority in road construction projects by deploying manpower such as flag personnel to enforce smooth flow traffic along construction sites, conducting routine inspections to make sure that guidelines and regulations are implemented during the construction phase, as well as preventive maintenance of infrastructure to assess road durability and safety. DPWH is also present in clearing roads in times of disasters, with quick response teams being dispatched before, during, and after the onslaught of typhoons, landslides, and floods. If we can recall, in early 2020, when Taal volcano increased activity that resulted to eruption, DPWH is one of those agencies on the ground highly involved, not just in clearing roads, but in helping evacuate residents from deeply affected areas. DPWH is also fervently looking into different technologies and applying the best ones to road infrastructure projects to help strengthen its capacity when it comes to daily vehicular traffic and protecting these roads from early deterioration. The DPWH stays committed in acknowledging relevant studies and researches on infrastructure development, traffic improvement, and road safety. In fact, the research symposium has been annually occurring through the initiative of our department's Bureau of Research and Standards since 2015. The said annual research symposium allows for the transfer of ideas, concepts, and designs from gathered engineers, researchers, and scholars from different government offices, universities, organizations, and the private sector. With these efforts and practices in place, we hope to greatly reduce the road crash accidents in the next few years. But of course, the responsibility and duty should not solely fall on the DPWH alone. That is why the coordination of every agency in charge of ensuring road safety, as well as the stakeholders and representatives from different public and private sectors and construction firms, is important. It surely takes a whole community doing their own special role, led by knowledge and discipline, to achieve the goal of reducing road fatalities and injuries. Before I end this talk, I would like to encourage everyone, drivers, pedestrians, cyclists, most especially public transportation, vehicle drivers, and operators, to equip ourselves with enough knowledge on road safety and defensive driving that will prepare us in our daily travel, whether to work or to go back home safely to our families. Despite the struggles and hardships that we are facing in the midst of this pandemic, let us also make use of the time given to us to be able to reflect on our own responsibilities as daily road users. Think of ways to reduce the risk of accidents as we travel, and make it a mindset to also consider the safety of the most vulnerable group of road users. Of course, we in the DPWH are with each and every one of you in this. Hand in hand, we will strive to build safe road networks and achieve the goal towards a brighter and safer future ahead of us. Maraming salamat po. Mabuhay po tayong lahat.
Thank you, Secretary Villar, to share with us updates on road transport and infrastructure and the drivers program. On behalf of Secretary Arthur Tugade of the Department of Transportation, we have Assistant Secretary Mark Steven Pastor. Attorney Mark obtained his law degree from the San Beda University in 2009 and is a member of the Integrated Bar of the Philippines. Prior to his current stint as the Assistant Secretary for Legal Affairs, he also served as the officer in charge for the Office of the Assistant Secretary for Administrative Services of the Department of Transportation.
My fellow resource speakers, all participants and attendees, magandang umaga po sa inyong lahat. On behalf of our tireless Department of Transportation Secretary, Arthur P. Tugade, I would like to express my gratitude for the opportunity to join this webinar led by the Department of Health, Philippine Council for Health Research and Development in collaboration with the University of the Philippines National Institute of Health. According to the 2018 Global Status Report on Road Safety, 1.3 million people die every year on the world's roads. In the Philippines alone, 12,487 road crash-related deaths were recorded in 2018 by the Philippine Statistics Authority, equating to more than 34 persons every day and 1 person every hour, which is unacceptably high. For the DOTR, road safety is a paramount concern that should be supported with policies, programs, and projects that will protect all road users, especially the vulnerable ones, our pedestrians and cyclists. Next slide, please. When the coronavirus disease 2019 pandemic broke out early last year, it has brought unprecedented circumstances in the country, majorly affecting industries including the public transportation sector. As we were faced with the challenge to regain the confidence of the riding public to use various mass transit modes, the department has put emphasis on policies, programs, and projects that will ensure road safety and efficiency of public transport services amid the health threats caused by the surge in COVID-19 cases in the country, particularly here in Metro Manila. The EDSA busway, providing dedicated median lanes for buses, is one of the projects of the Department of Transportation in partnership with MMDA and the Department of Public Works and Highways that aims to make travel more efficient for commuters now that public transport is a potential transmission vector of the virus. Through the EDSA busway, passengers of the major thoroughfare have been provided with safe commuter shelters at the median stations compared to the pre-COVID curbside waiting areas that are deemed unsafe. Next slide, please. Pre-COVID, buses in mixed traffic have caused major road congestion as this pick up and drop off of passengers along EDSA, disregarding the use of the bus stops. Because of the disorganized system, commuters can be seen lining up in clusters at the curbside as they wait for the buses to arrive. Next slide, please. Now, through the implementation of the EDSA busway, travel time has been significantly reduced. From 2 to 3 hours of travel from Trinoma to Ayala, it has now been shortened to around 35 minutes. If I may add further, from Monumento all the way to MOA used to be more than 3 hours. Now we can have it in an hour and 15 minutes. Bus stops have also been established at the median lanes for the commuters. Next slide, please. Aside from the EDSA busway, we are also continuously implementing the Public Utility Vehicle Modernization Program, or PUVMP, which is one of the transformative projects of this administration. The PUVMP ultimately aims to improve the urban quality of life, reduce economic loss due to unwanted traffic, reduce health costs and premature deaths, reduce pollution, and improve the economic well-being of the drivers and operators. Next slide, please. The PUVMP requires all PUVs to comply with the Omnibus Franchising Guidelines with the following features. It should be environmentally friendly, Euro 4 emission or better, electric, solar, or alternative fuel. It also needs to be safe with side doors, speed limiters, automatic braking system, and compliance with safety standards. We are also promoting security through the installation of CCTV cameras, GPS, and dashboard cameras. And of course, first and foremost is the comfort and convenience of our passengers, particularly the persons with disability, those who are elderly. We also provide Wi-Fi and automatic fare collection system. Next slide, please. Another initiative in line with ensuring road safety is the Motor Vehicle Inspection System, or MVIS, which is a program under the Land Transportation Office. This uses technology-driven inspection facilities to test the roadworthiness of vehicles. In the operation of MVIS, human intervention is reduced to a minimum, curtailing the potential for corruption as well. Vehicles will undergo a 3-stage inspection with 73 inspection points. Visual inspection for stage 1, alignment, suspension, brake, and speedometer tests for stage 2, and sound and level headlight tests for stage 3. Next slide, please. To reduce road crash incidents involving human errors such as negligence, the LTO has also enforced stricter rules and regulations in the current licensing system in the country. Under this, only qualified drivers will be given the permit, and for students, applicants have to complete the 15-hour theoretical driving course program. Lastly, for the renewal process, the driver needs to complete the 8-hour driving enhancement program before acquiring his or her renewed license. Next slide, please. Before the drivers can renew their licenses, they should complete the driving enhancement program, in which the hours will depend on the demerit points levied to them if they have violations. For PUV drivers, demerit points will be doubled when they violate traffic rules and regulation. This is really important. Next slide, please. As road crashes are mainly caused by speeding vehicles, the enforcement of speed limits in accordance with Republic Act number 4136 is being implemented to guide local government units in setting speed limits and in training enforcers on best practices. The DOTR and the LTO have inked a memorandum of understanding with Imagine Law, a public interest law organization, for the nationwide training for law enforcers from the LTO, Philippine National Police Highway Patrol Group, and the MMDA. Through this, enforcement of speed limits will be properly implemented, from the classification of roads, installment of speed limit signs, coordination mechanisms with national agencies, capacity building, data collection through drivers, and the template ordinance will be accordingly provided for LGUs to follow. Next slide, please. For data collection, the department, in partnership with the World Bank, has developed a system for road crash data collection in the country called the Drivers, or the Data for Road Incident Visualization, Evaluation, and Reporting System. Next slide, please. The Drivers is a web-based and open source system that encoders from both national and local agencies can geospatially record and analyze road crashes. The database links multiple agencies and standardizes the terms and definitions for reporting road crash data. Aside from this, the system also has a suite of analytical tools to support evidence-based investments, policies, and a platform for monitoring the impact of interventions. The next slide, please. The drivers can be accessed through the roadsafety.gov.ph. I repeat, it's roadsafety.gov.ph. The dashboard of the system will show the road crash reports for the last 90 days, map of incidents, and black spots by severity, and the summed up economic cost of these crashes. Next slide, please. With the initiative of the World Bank and in coordination with the DPWH, DOTR, PNP-HPG, and other agencies, a new version of the drivers will be launched soon. Improvements in the system include movement codes and collision diagrams based on the DPWH manual and the integration of the International Road Assessment Program, DOH, PCHRD, and to UPNIH for inviting the DOTR to this webinar. I hope this will yield productive results and effective exchange of ideas for future collaborations. Mula po sa aming kagawaran ng transportasyon, sa pangunguna po ng aming mahal na kalihim, Secretary Arthur P. Tugade, maraming salamat po. Magandang umaga po muli sa inyong lahat at mabuhay po kayo. Thank you. Ma'am, I think you're on mute.
Thank you, Assistant Secretary Pastor. Truly delivering reliable, accessible, and efficient road-based public transport system is a goal that all of us can be a part of. Our next speaker is the current director of the PNP Davao City. He is known for his principle, Serbisyong Tama at May Malasakit. He is a recipient of various medals and awards. In 2019, he was the regional chief of the Highway Patrol Group in Region 3, which was awarded the Best National Highway Patrol Group Unit nationwide. He also received the Medalya ng Paglilingkod sa Luzon, Medalya ng Paglilingkod sa Visayas, Medalya ng Paglilingkod sa Mindanao, Medalya ng Paglaban sa Manliligalig, Military Merit Medal, and several commendations from different sectors of the Philippine society. He also continued his education and training in Yunnan, China, Australia, and Cesena, Italy. To show us the role of government enforcement in creating safer roads, let us all welcome Police Colonel Kirby John Brion Craft.
Ma'am, mayong buntag. Salamat po sa inyong pag-imbita to speak before you regarding safer roads for stronger enforcement. It's an honor for me. So I will be presenting to you my research regarding safer roads for stronger enforcement. Next slide, please. So in a study conducted by World Health Organization in 2019, so about 1.35 million lives are lost every year due to road crashes, while millions more suffer from serious physical injuries. So in the Philippines alone, in our country, about 12,000 die on the road annually. But these unfortunate incidents can be prevented through stronger enforcement and careful investigation of the hazards that contribute to its occurrence. crafting of an integrated road safety policy to address each identified hazard is also of equal importance. Next slide, please. So law enforcement being one of the pillars of the World Health Organization, Decade of Action for Road Safety undeniably plays a vital role in the prevention and control of road crashes and fatalities in the road. Next slide, please. So, enforcement allows the punitive side of the law to effect against violators. So, aggressive, intensified, and sustained enforcement brings about a chilling effect. So, chilling effect, or a sort of warning to others that if they do not abide with the law, they will suffer the consequences. It also persuades and motivates people to change their attitude, behavior towards road safety. So the higher the fine, the more drivers are motivated to drive safely. So the concept of traffic law enforcement stems from the general theory of deterrence, which suggests that people will be less likely to engage in undesirable behavior when there is a possibility of sanction. So sumusunod lang tayo, natatakot tayo dahil mayroong parusa. So deterrence theory combines with rational choice theory in this context to suggest that in the arena of roadway safety, drivers will make informed, rational choices on their driving behavior based upon the celerity, certainty, or severity of sanctions. So by Persal 2014, Makoski, and Stratman 2011. So when examined in the context of reducing roadway accident, injuries, and fatalities, the causal chain will suggest that the deterrent effect of traffic sanction would result in less risky driving behaviors and will thereby reduce the likelihood of severe accident or injuries. So research by Blaise and Dupont. Next. In a study conducted by Stuart Greer of New York University Wagner School of Public Service entitled Does Police Traffic Enforcement Result in Safer Roads? A critically appraised topic published in March 2017, he concluded that there is a correlation between enforcement actions and the number of accidents, injuries, and fatalities that result from traffic accidents. So this study could be supported by our data from our traffic enforcement unit here in Davao City Police Office, which shows a significant decrease of 44.1% in the number of road crash incidents for the first quarter of 2021 versus the same period of 2020, as enforcement efforts were increased to 54.8%. So more than half. Next slide, please. So here is our data. So there were 1,940 incidents in 2020 as compared to 1,084 in 2021. So a decrease of 44.1 in vehicles involvement in road crash. So it caused by human error, road defect, vehicle defect, and other causes like weather condition. Next. So apprehension. So we increase our enforcement. So from 8,867 apprehended or apprehension in 2020, it was increased to 220 or 19,617 in 2021. So an increase of more than 50% or 54.80%. So top 3 apprehensions are overspeeding, illegal parking, and disregarding traffic sign. Next slide, please. So reckless imprudence resulting in homicide or overspeeding decreases by 50% in 2021. So we have 28 incidents in 2020 and 14 in 2021. Next slide, please. So since overspeeding was identified to be one of the major contributors to road crash fatalities, speed enforcement efforts were also sustained through the support of the Davao City local governments, which provided the speed gun for the use by our traffic enforcers. So we also have one of the best practices here on road safety in Davao City, wherein a city ordinance was passed during the time of then Mayor and now President Rodrigo Roa Duterte, wherein a speed limit of 30 kilometers per hour were implemented in the inner or downtown areas, while 40 kilometers per hour on the provincial and barangay roads, and speed limit of 60 kilometers per hour on national highways. So as a result of our enforcement with the use of speed gun, a total of 18,881 violators apprehended since October last year, decreasing the number of road crash fatalities from overspeeding by 50%. So only last year, October, when we were given speed gun by our city government. So that is why from that time on, there were a significant decrease in the number of road crash incidents by overspeeding. Next. So efforts on other perceived risk factors like drunk driving, not wearing of helmet, and non-wearing of seatbelt are given equal priority as shown on the apprehension on the data of mentioned violation. So we have 115 for violation of Republic Act 10586 or the anti-drunk and drug driving. 489 for violation of Republic Act 8750 or the Seatbelt Use Act of 1999, and 440 for violation of Republic Act 10054 or the Motorcycle Helmet Act of 2009. Next, please. So, but enforcement also has its own limitations and cannot address the road safety concern on its own. Even if enforcement efforts shall be sustained on a 24-hour basis, enforcers can only cover a limited area. So we cannot cover all the roads in Davao City. Thus, enforcement must be integrated with the other pillars to create a sustainable road safety plan. So, in the end, strict enforcement plays a vital role in road safety. So, as traffic enforcers, we are committed to make Davao City roads safe to all passengers or drivers and passengers or everybody. So every now and then, we all share the road. Sometimes we even bring with us our children and other loved ones. So we need to strive to make our roads safer for everybody, not just for today, but also for the future. Next slide, please. So if you happen to pass by Davao City, so this is our hotlines. So we have the dial 911, so easy to remember and easy to dial. And then the Davao City Police text hotline. Next slide, please. So with that, that ends my presentation. Madayaw na adlaw sa inyong tanan at mabuhay po kayo.
Thank you, Police Colonel Kraft. Some accidents on the road can be prevented. One thing we can do is keep our devices or any distractions away while we are driving. Focus your eyes and mind on the road. and drivers should put the safety of their passengers a priority. Here is a video to remind us that passengers have the right to be safe when riding public utility vehicles.
Speaker nyo.
Tandaan naman po.
Baba na lang kami. Mamatay kami dito.
Anong inaan mo kasi yung tugtog mo para marinig mo yung pasahero ko? Ano ngayon na? Baba na lang. Matikabulis na rin. Baka kami naririnig. Ayoko na. Bababa na ako. Ayoko na.
Kapag magmamaneho, itabi muna ang devices at gadgets para sa iyong kaligtasan at kaligtasan ng iba. Huwag maging distracted. Keep your eyes on the road.
Indeed, millions of lives can be saved and injuries prevented with well-enforced road safety laws on speeding, driving, and drink driving, use of seatbelts, child restraints, and motorcycle helmets, road design, improved vehicle standards, and better emergency care can also save many lives.
To share her thoughts about this session, we have Ms. Dasha Maurice Uy. Ms. Uy is currently a Health Program Officer at the Department of Health, Health Promotion Bureau, Program Implementation and Outreach Division, where she handles portfolios related to active transport, among others. Her work in active transport has made her an advocate for road safety and an avid cyclist in the Philippines.
Good morning. Can I be heard?
Yes.
Hello. Okay, thank you. For all of the informative talks this morning, we echo and agree with all of the points of our previous speakers, and we in the Health Promotion Bureau remain committed to improving road safety in the country, not just by changing our individual behaviors, but also by changing our physical and social environment in such a way that it's easy to follow rules. We can the health of transport as a point of entry to reform our roads. So we already know this earlier. This has been a point that has been repeated over and over, that road crashes are the most common cause of injury to Filipinos, and we see that this will continue to increase with the number of with an increasing number of motor vehicle usage and ownership as well. And this affects syempre yung pinaka-vulnerable natin na road users, so including our children, and young adults, our cyclists, and our pedestrians, as well as others who can't really access our roads anymore due to safety concerns. So that includes our PWDs, our seniors, etc. So cyclists and pedestrians are the most vulnerable to road crashes and related injury or death. So we do see that cyclists, road crashes involving cyclists result in injury or death almost 70% of the time, and pedestrians make up 44% of all fatalities during road crashes. So this is based on data from the MMDA as well. But we do see that injuries and deaths among cyclists and pedestrians decrease as active transport use increases. No? And this is for three reasons. First is decongested roads. So switching to active transport reduces the number of motor vehicles on our roads, giving more space to motor vehicles which actually need the road, such as ambulances. No? So this has an impact on both the number and severity of our road crashes. There's also the safety in numbers theory. As more cyclists become visible on the road, motorists become more cautious also, so as to not crash into cyclists. And last, dedicated bicycle lanes will protect our cyclists, especially beginner cyclists, from high-speed traffic and large vehicles with blind spots. And so again, active transport is our entry point for road safety reforms. This is a key part of the government's COVID response. No? So it's a way to provide a safe mode of transport for many Filipinos. It's a safe mode of transport for many Filipinos, no? Ngayon na COVID, so we can prevent the transmission of COVID, especially on public transport. And so long-term reforms are made possible now during the COVID pandemic, and we're taking advantage of these opportunities. So we in the Health Promotion Bureau also want to highlight that active transport can prevent the health problems caused by non-communicable diseases. No? So NCDs can actually be prevented through active transport or any form of transport for 30 minutes, at least 30 minutes a day. And cycling is also a great opportunity for making our roads more accessible to children and seniors and other vulnerable sectors as well, including low-income, minorities as well, and their health. So we see that actually our vulnerable populations benefit more from the affordability of cycling, from the health benefits of cycling, and the access to public and essential services. And we see there is demand for active transport reform. We see that net agreement for both statements below is very strong in a social weather stations questions commissioned by the Department of Health. So we see that it is possible for my city and municipality to become a great place for walking and cycling. There's a net 77% of people agree. And then again, for roads in Philippine cities and municipalities will be better off if public transportation, bicycles, and pedestrians are given priority over private vehicles. Again, 81% of people agree. And we just want to show some some of the things that we've been seeing, from our small case studies around the country. So we, in the DOH, we helped the municipality of Cordova launch a 1.5-kilometer bike lane with the help of a sub-allotment grant from us. So we gave them 2.85 million pesos to launch 1.5 kilometers, and they saw a 326% increase in the number of cyclists and fewer bicycle-related road incidents as well. So they started planning for another almost 20 kilometers of bike lanes to be developed between this year and 2025. And we see the same effects also in Pasig City. So along Amang Rodriguez Avenue, Pasig City has a 3.4 kilometers of bike lanes. At peak hours, we actually see more bicycles than private cars using the road. And these bicycles, there are more bicycles than even predicted by international standards for the widest two-way bicycle lanes. So we just wanted to show you this, just we do feel now. And so that's why we in the DOH have been working with DOTR, DILG, and the DPWH in the Interagency Technical Working Group to roll out bike lanes in our major metropolitan areas. And we're hoping to expand that work with regard to road safety and human-centered spaces as well. One of the tools that we in the Health Promotion Bureau have rolled out is the Local Health System Health Promotion Playbook on Active Transport. So this is a ready-to-use tool for local government units to promote bicycle use and active transport in the new normal. So all the tools here to roll out protected bicycle lanes and pedestrian walkway networks are already in the playbook, including the template ordinance, the resource requirements, capacity building needed for our officers in charge for the bicycle lanes on the ground, implementation checklist, M&E, communication materials, and FAQs. So you can download that playbook at the link shown on your screen now, or bit.ly/HPB_2021 playbooks. So again, that's bit.ly/HPB_2021 playbooks. But road reform, we know, to promote active transport and improve road safety involves more than just installing protected bicycle lanes. So among the lessons that we've learned in the past year or so that we've been working on active transport and road safety, we've really learned a lot about involvement at all levels. No? So we have pretty good coordination at a national level. Again, we're working with DILG, DPWH, and DOTR to provide technical support for our local government units. So involving our local government units is very, very important to create better policy, for road reform and road safety. And we also have good coordination again with our civil society and with our cyclists and road users as well. So I think those are just some of the lessons that we've learned and things that we can take moving forward now into the future as but also our road design interventions, so rotundas, humps, etc. Improving vehicle safety through design, and also improving our road crash medical response. So there's a lot we still have to do. We look forward to continuing to Sorry, I think naputol ako. Sorry. Okay, so again, there's a lot we have to do. We look forward to working not just with our national government agencies, but also with civil society and everyone present now to continue to improve road safety in the country po. So maraming salamat for all the talks. It was a very good learning experience for everybody po. So thank you very much. That ends my reaction.
Thank you, Ms. Dasha. At this point, may we have a group photo? Speakers and opening ceremony guests first, please, if you don't mind opening your video so we can take a screenshot. One, two, three. Again, one, two, three. Then with the panelists and organizers as well. Okay, thank you, everyone. We move on to our question and answer portion moderated by Dr. Ted HERBOSA. Dr. Ted.
Well, thank you, Sophie, and thank you to all the speakers. We have limited time for our Q&A, so I will just throw in about 3 questions. Maybe we'll ask them for short and quick answers so that we can save time. The first question is for Dr. Caroline Lukasic. Aside from the compliance to traffic rules and regulations, what else can the private sector do to improve road safety?
Thank you very much for the question. That's really excellent. I think the private sector is a very, very important partner for our work with road safety. Of course, we can secure investment for a number of projects we want to lead, but they also have fantastic reach as well, and they're able to reach other populations that primarily us as a WHO and also our partners through the health sector cannot reach. So again, this is a very important collaboration and partnership to nurture and move forward with. And again, we also, through WHO, really like to formalize this through terms of reference and the establishment of formal committees and networks too. So thank you very much.
Thank you, Dr. Lukasic. We'll reach out to our private sector in the Philippines. For Dr. Juilliard Go, regarding the 4th initiative on road safety, i.e. the safe road users, can the Philippines afford to give free road safety education to the marginalized? And if not, how much does such education cost? John? Is John still there? So, there. Okay. I think you're on mute, Okay, thank you. No audio?
Sec, can you hear me better?
There, very good. Thank you. We can hear you.
Yeah, it's a multi-sectoral effort for all of us. There are different ways for which we can always engage with communities, including those that are in hard to reach areas. So I think government and non-government organizations can definitely do a lot to be able to make sure that the communication messages that we want to impart and the behavior that we want communities and individuals to adopt will be able to be realized, no, in our engagement with various communities through various means. Definitely, media is an important partner, but organizations that directly engage with communities can definitely do a great share in educating the public and instilling greater awareness and promoting safer behavior among communities and individuals. Over to you, Sir Yusek. Thank you.
Thank you, Dr. Go. Very important impact. We highlight the importance of whole of society approach in these road safety efforts that we're trying to improve. The last question I'd like to throw is to Dr. King. How much funding does the Australian government really provide for road safety? Is there such an estimate?
I am afraid I can't tell you off the top of my head. I know that it's actually a difficult question to answer. At each of the state levels, we try and generate a figure, but if you think about policing, where we rely on police enforcement, we don't have a dedicated traffic police. It's just police in general, and then they have traffic divisions within there. But often traffic enforcement will be conducted by police doing general duties. So working out a total figure for enforcement is tricky. There will be a figure for the amount that the government spends on financing black spots. That's national funding. And for some other bits and pieces as well. The other side, the post-crash care, again, it's a bit difficult to tease that out because from a health system, quite often they're not making much discrimination between people who come through the door with road traffic injuries from other forms of injury. So I could probably dig out a figure for you that someone has estimated, but I don't have it right at hand at the moment, I'm afraid.
Thank you very much, Dr. King. I think if I was asked the same question for the Philippines, my answer would be similar to what you said. So with that, what I will do is I will get all the questions from the chat box and ask our team to actually send it out to the specific speakers that have contributed this morning. Thank you very much. And I pass it on back to our Master of Ceremonies, Sophie and Jinky.
We thank you for taking part in our first webinar on road safety, a decade of success ahead. So for the evaluation form, please log in at the link shown to you on the screen. So this is a requirement for the certificate of attendance. May we call on Dr. Ted again to synthesize this session and provide his closing remarks.
Reducing road traffic deaths requires paying more attention to the needs of everyone using our roads, drivers, commuters, pedestrians, among others. As our speakers underscored today, promoting safer roads should be a collective responsibility of everyone. With a high number of road crashes inside and outside our country, we must be committed to lowering road crashes each year. The World Health Organization emphasizes the 5 pillars or steps we can take to achieve road safety and make zero road casualty possible. First is building road safety management capacity. We heard our government efforts earlier to make this possible. This includes encouraging multi-sector partnerships to develop and lead the delivery of national road safety strategies, plans, and targets for the Philippines. Next is improving the safety of our road infrastructure by raising standards and quality of road networks that will benefit all road users, especially the most vulnerable. Regular assessments of road systems should be made to inform planning, design, construction, and operation of the roads we use every day. We still have upcoming sessions wherein we will dig deeper into the different strategies and traffic management and road safety we have in the Philippines. We encourage everyone to join us next week by registering using the QR code on the screen or the link provided. We end this webinar by reminding everyone, road safety is everyone's responsibility and should be everyone's priority. Mabuhay ang DOH, mabuhay ang DOST, mabuhay ang NIH at UP Manila, mabuhay po ang Pilipinas.
We hope to see you everyone again next week.
Mark your calendar, June 2, June 9, and June 16 for our next series.
Be safe
Be
on
safe
the road.
on the road. Mabuhay.
Mabuhay. Thank you. Thank you, everybody. Thank you.
Congratulations, no major boo-boos, no major riches.
Thank you, Doctor. Thank you, Asset Passport. Thank you.